working last year in a rotation called the Clinicians in Redesign, and part of that was doing a QI project and being involved in a change in a system that would hopefully eventually help with patient safety. And part of that, I think I was on an emailing list and I got an email about this roundtable, and I thought, oh, I don't really know what that is, but it sounds interesting, let's do it. So I applied, was really well supported by my mentor who wrote me a great reference, and thought that I'd really love to come and learn some skills about how to make changes in the workplace that benefit both the junior doctors and the patients who they care for.
I was motivated to get involved in this workshop because what I really love in medicine is caring for patients, but beyond that, having the opportunity to make systems work better and to work better for the patients that participate in those services to receive healthcare, but also to make those systems better for the clinicians that are working in those systems for their patients. I think there's huge opportunities for our systems to operate in a way that's safer and more equitable.
A couple of the things we learnt about were really, really helpful. One of them was a thing called graded assertiveness. I've always found in an arena such as a school environment, such as talking to people about things I'm passionate about, I can talk to people. I don't get shy, I don't get nervous, I just talk and like my mouth off. But in a clinical environment, I find that really difficult. I'm sometimes unsure of my skills, I'm unsure of the hierarchy, could be quite disempowering, and you're never quite sure what to say when and who to listen to. One of the tools we learned was about graded assertiveness. So if you see something that you think is wrong or dangerous, you just say, oh, I think I'm concerned about this. Could you explain why you're doing it? And that might trigger to someone, oh, hang on, what am I doing? And then you go up and you say, oh, maybe we could try this. And then that gives them an idea of where to go to next. And then there's a few more steps which are more difficult to implement if your actual health system hasn't agreed on it. So one of them is used in the airline industry. You say, stop, we have a problem. I'm not going to do that to a consultant in a hospital at this stage, but it really gives me a tool in which to at least start off these conversations, and gives me confidence to be able to stick up for my patients and when I'm concerned about their safety.
One of the strategies that I'm going to implement is to role model leadership behaviour in patient safety, and part of that is always remembering to see the patient even when things are busy and stressful. The second thing that I'm going to do is to use all the fantastic knowledge and skills I've gained when I'm undertaking quality improvement projects in my workplace.